Hello everyone, welcome again. So today in this video I am going to discuss about the Down syndrome and all the previous year questions which already asked in the exams. We cover everything related to the Down syndrome. So as we heard the name Down syndrome, we always remember that in this there is trisomy 21 will be there. So trisomy 21 will be there, which is already a question itself, that trisomy 21 is seen in Down syndrome. Now for the all the clinical features, we have a mnemonic for the Down syndrome. So let's get to the mnemonic. So the mnemonic is do eyes checkup alongside. So in which all the do eyes checkup along the side. So all the letters have three features, like the letter D has three features, E three features, C three features, A three features, O three features, and S for three features. Now what were the features for the what were the features which were started from the D letters? So for the D letter there is depressed nasal bridge. So in this depressed nasal bridge will be there. Next D stands for there is decrease IQ. So from here I have one question, that in all the syndromes there is decreased IQ level, there is decreased mental retardation, there is decreased intellectual disability, except so there is one syndrome in which there is no effect of effect of IQ level in that syndrome, that is the Turner syndrome. So please remember, in Turner syndrome IQ level will not decrease. So in Turner syndrome IQ level is normal. So here itself a one question, and this is the other one. Now the third D stands for there is down ear, means the ears, like as we all know, as we draw one line from the eyes, then there is ears, but here in Down syndrome there is down ear will be there, means low set ear will be there, low set ears will be there. So I hope all the features from the letter D is you already remember now. D for depressed nasal bridge will be depressed, there is decreased IQ level, and there is low set ears will be there. And the Turner syndrome, in Turner syndrome IQ level will be normal. Now the next letter, that is the E. So from the E there is also a three features. E remembers of eyes. In eyes we have epicanthal folds. So epicanthal fold is skin fold of the upper eyelid covering the inner corner of the eyes. So in this we see the epicanthal folds. Epicanthal folds. And what is epicanthal fold? Epicanthal fold is a skin fold between the upper eyelid covering the inner corner of the eyes. So this one is the first eye. First letter E stands for epicanthal folds. In epicanthal folds, and also we see that there are brush filled spots will be there in the iris. So brush filled spots in iris we see. Epicanthal folds, brush filled spots in iris, and there is a mongoloid slant will be there. So in eyes we have mongoloid slant. So what do we mean by mongoloid slant? So mongoloid slant, basically in eyes we see that the eyes were like this, upward eyes will be there. So that is the mongoloid slant. And we have mongoloid slant, and we have another one, that is anti-mongoloid slant. So what do we mean by anti-mongoloid slant? So in the anti-mongoloid slant, what do we mean? We have like there is downward direction of the eyes. So if the eyes is downward direction, then it is anti-mongoloid. If eyes upward direction, then it is mongoloid slant. In anti-mongoloid, I remember it like T for Treacher-Collins syndrome, T for Treacher-Collins syndrome, N for Noonan syndrome, N for Noonan syndrome, and one more, that is the Cry-Do-Chat syndrome. In these three conditions, we see anti-mongoloid slant. So please remember Cry-Do-Chat syndrome. So I hope you remember from now that in which conditions we see the anti-mongoloid slant. So anti-mongoloid slant is seen in these three conditions: Treachercolin, Noonan and Cry-Do-Chat. In anti, the letter comes T and N, that stands for Noonan and Treachercolin, and one you remember Cry-Do-Chat syndrome. Now these all were from the E letter, that is eyes. We see epicanthal fold, we see brush filled spots in the iris, and we see anti-mongoloid slants. Not the anti-mongoloid slant. Now the next word, that is the C. So for the C, we see that in the downward syndrome we have one C is for the congenital heart defect. So which is the most common congenital heart defect? So most common congenital heart defect is ostium primum, atrial septal defect, ostium primum, and the most specific is the endocardial cushion defect. Most specific is endocardial cushion defect, endocardial cushion defect. So in this we have to remember that most specific is the endocardial cushion defect and most common is the ostium primum atrial septal defect or ventricle septal defect. Now next C, the other C stands for, first one is for the heart, second one is for the congenital hypothyroidism will be there, congenital hypothyroidism will be there, and another C is for clinodactyly. Clinodactyly, what do we mean by clinodactyly? Like this is our hand fingers, all these are normal, but in clinodactyly our end of the digits is slightly tilted, slightly deviated, so that is known as clinodactyly. I hope you got my point. So that is the clinodactyly. So these three defects for the letter C: congenital heart defect, congenital hypothyroidism and clinodactyly. Now the next letter, that is the letter A. So from the letter A we have again three conditions. So from the letter A we have again three conditions, and what were those three conditions? So first one, that is the atlantoaxial instability. There is instability between atlas and axis. Atlantoaxial instability will be there. And the next A stands for AML, that is acute promyeloblastic leukemia, AML-M7. Please remember AML-M7. And the last A stands for the Alzheimer's disease. Means this condition, Down syndrome, is presenile to Alzheimer's disease. So Alzheimer's disease. Here all these 3 points are very very important. So one question which asks that after which age the AML M7, like in Down syndrome we found both ALL and AML, but which after how many years the AML M7 will not seen, or after how many years ALL will see? So after the limit is the after 3 years. So till 3 years it is AML M7 and after that it's ALL. So AML M7 till 3 years. After that ALL is the most common. So till 3 years AML M7 will be there, and after that there is ALL leukemia will be there, which is the most common. Now the another letter, that is the O letter. In along we have A and O. So from the O letter, which conditions we will see? So from O letter we have O stands for the occiput flat. In these trials we found the occiput flat. Another O stands for open wide fontanelle. So here the O means the O face, means the face is round, and in the Down syndrome we see the brachycephaly. We see brachycephaly because there is a fusion of the sutures. Coronal fusion is problem will be there. So coronal suture problem will be there. Now the another side, S stands for side, and here also we have three features from the letter S. The first one, there is single palmar crease will be there. So that is also known as simian crease. That is also known as simian crease. As in our hands there were two lines, but in those Down syndrome children only there is one line, that is simian crease. Another S stands for the sandal gap. There is sandal gap present between the toe and the fingers. And another S is for short head, and short head represent the brachycephaly. Now that's all about the trick, that is do eyes checkup alongside. All have three clinical features about each letter. Now the next one, here I have one extra point, that in which conditions we see the simian crease. As we study, first one is the Down syndrome. Another one, like fetal alcohol syndrome, also has the simian crease in trisomy 13. In rubella syndrome, in the Turner syndrome, in the Klinefelter syndrome, and in the Cry-Du-Chat syndrome. In all these conditions we see the simian crease, means single palmar crease we see. Now the next one, that is the how the features will look like. So here let me show you some images. So as in this image, as we see the eye, that in this we see the brush-filled iris we see. And here this one is the epicanthal force. This one is a epicanthal force which is seen in the Down syndrome. Another one, this is a sandal gap. So this is a sandal gap present. And this one, when the little finger is curved, curvature is there, that is known as clinodactyly. So all these are the features of the Down syndrome. Now I have some questions like which were previously repeated. So my first question is, like in which condition we see the Moro's reflex is absent. So here my question is, Moro's reflex is absent in. So it's a basic question because now we are studying the Down syndrome. So here the answer is Down syndrome. So in Down syndrome we see the Moro's reflex is absent. And in spite of the Down syndrome, we have more two conditions in which we see the Moro's reflex is absent, that is HIE type 3 and also the connecterus. In these conditions also we see the Moro's reflex is absent. HIE stands for hypoxic ischemic encephalopathy. Now my next question, what is the GIT condition we found in the Down syndrome? So in the GIT we see the duodenal atresia. We see a duodenal atresia in the Down syndrome. And on chest x-ray, how we find that it is a duodenal atresia? Please remember, we see a two bubble sound. On chest, on x-ray we see two bubbles. If one bubble is there, then it is CHPS, that is congenital hypertrophic pyloric stenosis. And if we see three bubbles, jejunal atresia. So if pyloric stenosis, one bubble. If duodenal atresia, D for duo, and duo also known as 2, and 3 in jejunal atresia we see the triple bubble sound. Let me show you some images. So as we see in this image, in this we see a one bubble and two bubble. So here two bubble will be there. So it is a duodenal atresia. While in this image we see only one bubble, so that's why it is CHPS, that is congenital hypertrophic pyloric stenosis, because we only see one bubble is there. In Down syndrome, what were the most common causes of Down syndrome? So the most common causes of Down syndrome, what were those causes? So for the causes of Down syndrome, we have the first cause is, that is the most common, that is a non-disjunction. Means 95% of Down syndrome were due to the non-disjunction. Non-disjunction means because the chromosomes do not split apart. So that's why most common cause is the non-disjunction. Now the next one, that is what is the most common cause of the Down syndrome? So the most common is the meiotic non-disjunction, and the second most is the, like, there are other causes were also, and the second one is there is translocation is there. Translocation will be there, like only 4% patient have the translocation. And the third common cause is the mosaicism. So in 1% cases there is mosaicism will be there, and also the balanced translocation will be there. And all the babies who have like balanced translocation, then all those babies have 100% Down syndrome. So in balanced translocation, if balanced translocation will be there, then 100% the patient have Down syndrome. So I have one more question, like if a mother is present with a chromosomal translocation, suppose 21-21, then what is the risk of the syndrome or in the child is? So the risk is like 100%, because there is translocation is there. If translocation is there, then 100% chances that the baby have Down syndrome. So please remember this point, it's very very important. Now if there is like a female who has balanced translocation between like chromosome 15 and 21, like who have a child with Down syndrome, and the child has translocation between chromosome 15 and 20, then we have to advise the child to abort that child, because it's very very, like for parents also, it's very difficult to have a child, to have a diseased child, to have a syndromic child as compared to a normal one. So that's why we always advise, if there is translocation, we always advise the patient to get aborted. Now my next question is, like, what is the most common chromosomal abnormality in the Down syndrome? So the most common chromosomal abnormality in Down syndrome is 21. Now let's move to the screening part, like how we do screening. So for the screening, if the parents, if the mother is presented in the first trimester, then what we are going to suggest, and if she is present in the second trimester, then what we are going to suggest him, what screening test we have to do. So for the first trimester, the screening test will be beta HCG, and the other one, that is papa. And for the second trimester, we have to suggest to do the triple scan. And in the triple scan, what were the things? We have to check the alpha fetoprotein, we have to check the unconjugated estriol, and we also have to check the beta HCG level. This comes under the triple scan, which we are going to check in the second trimester. While for the quadruple scan, we have to check all these three conditions plus inhibin A also. We have to check. So in the quadruple scan we have to check. Now just remember the full form of the papa. So for the papa, that is the NC associated with plasma protein A, and it is reduced here. So we find reduced in the first trimester. Now in the first trimester we also see the knuckle thickness NT, which is more than 3 mm. Please remember, knuckle thickness is more than 3 mm we found in the first trimester. What is the knuckle? Knuckle is the posterior cervical area, that is known as the knuckle. So in the knuckle thickness, in the like 11 to 14 weeks, we found knuckle thickness is more than 3 mm, while more than 6 mm is found in the 15 to 20 weeks. Please remember, in 15 to 20 weeks knuckle thickness is found more than 6 mm. And also in the first trimester we are able to see that in the Down syndrome case, the doctors usually write on the report that there is absent nasal bone. So absent nasal bone, which is like more important, we can easily, if on report we see there is absent nasal bone, we can easily identify that, oh, that it is a case of a Down syndrome. So in radiological finding, we found short femur, humeral length short is there, and absent nasal bone and duodenal atresia. All these are the radiological findings. While these scans we will find in trimester wise, like if we do the triple scan, then alpha fetoprotein and conjugated estriol beta hcg will be there, and if we have to do quadruple scan, then plus inhibin A also we have to check. Now, what were the levels we find in the Down syndrome? So in the Down syndrome, please remember high. So for Down syndrome, we have to remember high. High means increase. So H for beta HCG level and I for inhibin A. So these two levels will increase in the Down syndrome and all others will decrease. All others means like alpha fetoprotein, like estriol. So all these value will decrease and inhibin A and beta HCG level will increase. So this is for the Down syndrome. And also, like, what is the best test to identify the Down syndrome during antenatal period? So the answer is karyotyping, which is the best way to identify Downs during antenatal period, and also done by like chronic villus sampling, and also we can do the amniocentesis to find the karyotyping. So that's all for the Down syndrome. I hope this video is very helpful for you guys. Thank you. Bye bye guys. See you in the next video.